Hi guys, welcome back to my channel. If you're new here, you are welcome. If this is the first time of coming across my channel, I'm Ikemini. So in today's video, I'm going to be telling you things you need to consider before starting nursing. So without further ado, let's just get right into this video. The very first thing you need to consider when you want to do nursing is to make sure you know where you want to study your nursing in. What I mean is that there are two major routes of studying nursing here in Nigeria. It's either you go through the School of Nursing or you go through the university. If you want to go to the School of Nursing run their program for 3 years. Firstly, you know you must be a science student. You must have 5 credits in English, maths, biology, chemistry, and then physics. That is like the first criteria if you are thinking of doing nursing. After that, you apply for your school. Now that is where this university or School of Nursing comes in. If it is a School of Nursing, you know you are just going to spend 3 years, and the first year is the PTS. The first year is divided into 2 semesters, the first semester and the second semester. The first semester is for what we call the PTS class, which is a preliminary training section or school. In that PTS, it's a 6-month class. They will teach you anatomy, foundation of nursing, chemistry and physics, English, sociology, and moral ethics. Anyway, it differs for many kind of school, but after that 6 months you will be set on a test. You have to pass this PTS exam. If you are able to pass that exam, you will qualify for the second semester, which is now originally known as you being in first year. But if you don't qualify for that, if you don't pass that exam, most school can actually chase you out, while other schools will have you repeat that particular class. So after the first 6 months of you being in a nursing school, you will go for a ward experience, or what other schools call clinicals. It's just clinicals anyways. So you go for that clinical, which can last for maybe 2 months or 1 month, depending on how the school runs their own package. And then you move to the second semester of year 1. After your second semester, you move to your second year. Now, one very good thing about nursing school is that they do their experiences or clinicals intervally. I think every 6 months they actually go for an experience. And one very good thing about School of Nursing is that this experience is not based on a particular field. For example, this first 6 months you might go for a pediatric hospital where you just have to deal with children alone. The next month you might go to a community center and health center where you would see more of deliveries. The next month you might go to an ear and eye clinic where you'll be seeing lots of ear and eye issues. The next month you would go to a psychiatric. It just make you test all the various parts of nursing so that you will be able to know which one you can do, and then you would you further your education level more. But that is one good thing about School of Nursing. So after your 3 years in the School of Nursing is over, you're going to qualify with a certificate you're going to be issued an RN certificate, which is a registered nurse certificate. That is the highest certificate you can attain in a nursing school. And if you have an RN, that means you can work anywhere, actually, whether in the country or outside the country, because that is really what is needed for you to practice as a nurse in anywhere overseas. So that is it about School of Nursing. Then if you want to go through the university route, the university one is actually also very simple. You have to actually write JAM. Now if you want to go to a School of Nursing, you don't have to write JAM. So if you want to go to the university, you have to take your JAM. You have to meet the cutoff mark for nursing and then you have to, after passing your JAM, you have to go to your school and then you write your UTME exam. If you made a cutoff mark for that school, then you'll gain admission into the university of your choice. The study in the university for nursing is 5 years actually, so you have 5 whole years to study nursing. They do 1 year, first year, second year, third year. Then their fourth year, they do internship, where they do, no, the fourth year is for practicals. They do lots and lots of practical within that fourth year, and then the fifth year they do internship. So it's just for you, if you want to do nursing, it's just for you to know how long you have to spare when it comes to schooling. If you think you don't have much time to spare, or if you think you just want to do this nursing thing sharp and just leave, you have to consider, you have to choose whether you want to spend 3 years or you want to spend 5 years. Now, if you are also wanting to spend 5 years, like if you want to go to the university, you should also consider that there are strikes. So your 5 years might not amount to, now, but that is just what it is if you want to do nursing, whether in the School of Nursing or in the university. Meanwhile, I also forgot to add that School of Nursing now, they are divided into also two. There is College of Nursing and there is School of Nursing. School of Nursing might be managed by the states and so on, while a College of Nursing might be a private institution that is managed by maybe a group of persons or maybe a church. So you have to also know about this before considering studying nursing. Now, the second thing you need to know when you want to study nursing is to actually know your budget. You must know how much you have to spare, or how much your sponsor or your parents or yourself have to spare when it comes to studying nursing, because most times College of Nursing are very much expensive, whereas in university it is not as expensive as it is in College of Nursing. I don't know why it is like that, but that is just how it is. So you have to check for the school. You have to make research about the school you're going to, know how much they're paying for a year, or if they pay per semester, you know how much they pay per semester, and you know if there is accommodation, or if you have to pay extra for that, if there is food, or if you have to pay extra for that, if there are textbooks, or you have to pay extra for that. You just have to make your survey very well and know everything about that particular school you're eyeing, so that you will not put yourself inside, maybe you'll not get admitted into the school and then you are now stranded. So you must get everything in place and on check before applying for any School of Nursing of your choice. The third thing you must consider if you want to be a nurse is that you must know your capability. Like, you must know your resistance level. You must know how well you can accept certain things. Of course, before you want to do nursing, you should know already that you can't stand maybe blood, or you can't clean somebody's bum, or you can't clean somebody's urine. If you are somebody that easily gets irritated with those kind of things, then this profession is not for you. But if you think that, although I know it's not easy, there is no way you'd want to wipe maybe somebody urinated here or somebody vomited and then you want to clean it up. There is no way, there is almost no way, because there is a way. There is almost no way you would, clean up that messy place without keeping or having a certain kind of facial expression. It's just that you have to learn to control it. Mostly, you should always know that you should never ever do it when the person is around, or when you know that the person is seeing you and you're keeping a certain kind of face. It's going to make the person feel bad, or even the person's relative is going to feel somehow. So if you know you are easily irritated by all this kind of thing, then you should consider being a banker or a lawyer or a chef. But if you must come into this profession, then you must be ready and willing to do everything that is filthy and everything that some people might classify as being messy. Before considering being a nurse, you might not be too disciplined, but you should be ready to build yourself to be disciplined. You should be ready to build yourself to be very disciplined, in the sense that nursing is very, 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 very hierarchical. There is so much hierarchy in nursing. especially when you are starting, like especially when you are just being admitted, you're going to see all your seniors, whether in a nursing school or in university. You're going to meet them and you need to respect them. Now, it is as bad as you, if you sometimes, if you maybe walk past a senior and you don't greet her, she might call you back and then you greet her. That is just a tip of an iceberg, because what lecturers do to us is way too much. So if you are somebody that doesn't really care about other people, you need to start learning to care. If you are somebody that is not respectful, I mean, you don't care about if this person is, I mean, I am 20 years old and this person is 17 years old, why should I greet her? It's not going to work in this nursing profession. You have to be so humble, you have to be respectful, especially to your senior colleagues, and most especially to your lecturers. Even though you feel you are bigger than them in size, you are bigger than them in height or whatnot, or you are bigger than them even in age, because sometimes, many times, married people are always coming into the profession, and when they see younger people that are teaching them, they will be like, why is this, why is that, why is that, why is that? So if you are advanced and your lecturer is a small girl, don't feel like she's supposed to greet you, not you greeting her. It might happen in other departments, maybe the arts, all these people that any department, it can happen, but you see, this profession is not going to happen. I mean, it is why am I carrying this gun? It is something that is not going to work. The next thing to consider when you want to study nursing is that you must be very, very committed to your studies. There is no way you can serve 2 masters when it comes to studying medicine as a whole. And people often say that nursing is the easiest in medicine, but I don't know how true that is, because me myself that I'm studying this nursing, this was not how I mean, I wasn't expecting it to be this hard. So it is very, 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 very hard. And maybe I don't think it's doing, because every other person is complaining. So in case you're wondering, in medicine we have the pharmacists, we have the medical laboratories, we have the nurses, and then we have the doctors. So they are saying that nursing is very, very, is the easiest, is the primary. If you don't know nursing, if you can't study nursing, then you cannot study any of those other ones. I don't know how true that is, but my point is just that you must be very bent and focused on studying your materials. If you are somebody that is very lazy when it comes to reading, or when it comes to acquiring knowledge, or when it comes to searching and knowing about something, then you might not really make it in this profession, except you want to be doing magu. And you know, this is a profession that involves life. If you end up passing all your exams, if you end up passing all your theory, then you cannot do anything in your practicals, then that means you are a very, very bad nurse. You can't make it in life, because nursing is not about theory, it's more of practical, because that is what we are doing. It is a practicing course, it is an act. It is not something that you can just say and then you say it and then you say you cannot do it. It's not going to work. Another thing to consider when you want to study nursing is the fact that you must be ready to adjust to life. Especially if you want to go to a nursing school. I know almost all the nursing schools, not nursing school, like school of nursing kind of, not university. If you want to go to nursing schools, I know, in fact, nursing schools in general do not allow students cook in the hostel. So all the nursing schools will always cook for you. So if you want to go to a nursing school, you should start preparing your mind that you're not going to be eating all those food you eat in your house, and you're not going to be living the kind of luxury life you were living in your house, in the sense that they give you a day where you are supposed to go out, like in a week. They give you a day where you're supposed to go out, and then you get things you want to get, and then you run errands for yourself, and then you have to come back. Or like the university, where they can cook for themselves, and they can do whatever they want to do, and they can leave whenever they want to leave, and maybe come back whenever they want to come back, or maybe they have a time they're supposed to come back, but they can actually cook for themselves. If you want to go to a nursing school, just start wearing your mind that you are going to be refined from worse to better, because those people will trim you to be a very, very good and disciplined person. Unlike the university, they'll come for me. So that is basically it. And oftentimes people are always coming up with this controversial question, that is, between School of Nursing and university, which one is better? Well, I presently attend School of Nursing. Not presently, I attend School of Nursing because I feel like I don't have much time on my side. I mean, I just have limited time to spare. So to answer that question, I don't think anyone is better. School of Nursing is very good, as well as university. I mean, it depends on the students. It depends on the individual. If you are in fact, if you're not dedicated to your book, no matter how good a lecturer is, or no matter how beautiful a lecture is, because you yourself, you don't have maybe passion for what you're learning, or you're not motivated, you are not going to get anything out of that thing. So both schools do very well when it comes to lecturing and when it comes to giving out everything they have to give out to their students. It is just an individual factor. That is just it. And for me, because I am currently going to a School of Nursing, I would say that they are doing very well. They are doing perfectly well. The teaching, everything is perfect, and then we are going on experience on a very interval timing, so it makes it very, very easy, because this month or for the next 4 months you might be in class learning about maybe a disease condition or something, and then the next month again you are in the hospital seeing that disease that you people were actually talking about in class, and then all the signs and symptoms that you people talked about will just be revolving around your head because you are seeing them. It's so practical, and that is what they do also in university. So both sets of schools or both sets of learning institutions do very well. It is just an individual factor and individual reasons that make students come out dull. That is going to be the end of this video. I hope you've learned a whole lot, because I've spilled out a whole lot for you guys. Don't forget to thumbs up this video, subscribe to my channel, and share this video to your family and friends. See you in my next video. Bye.